Hey everyone, this is Sammy Simpson. Today I'm going to go over my concept analysis, which is on pain. Pain is something every person has or will experience sometime in their life. Whether it is acute or chronic pain, the experience is different for everyone. Pain is one of the main reasons that people seek medical attention every day. The American Academy of Pain Medicine states, "Pain affects more Americans than diabetes, heart disease, and cancer combined." Per the International Association for the Study of Pain, 1 in 5 people of all ages have moderate to severe chronic pain, with 1/3 of those in pain and of working age unable to work. Pain is a major public health problem that costs the United States society between $560 to $635 billion annually, which includes the total cost of health care due to pain and loss of productivity. The major aim of this analysis is to broaden and expand on the understanding of the concept of pain. I will also be clarifying the defining attributes of pain and identifying antecedents that influence the perception of pain and possible consequences of pain. My aim is to have a resulting theoretical definition, operational definition, and apply this to my nursing practice now and in the future as a nurse practitioner. My preliminary definition of pain: it is a subjective physiological or psychological feeling of discomfort experienced by a person that can come from an internal or external source. There are several definitions of pain throughout the literature. The International Association for the Study of Pain defines pain as an unpleasant sensory, emotional experience associated with actual or potential tissue damage, or described in terms of such damage. The Merriam-Webster Dictionary defines pain as a localized physical suffering associated with bodily disorder, as a disease or an injury, also a basic bodily sensation induced by a noxious stimulus, received by naked nerve endings, characterized by physical discomfort, and typically leading to evasive action. Another definition of pain: it is a complex experience consisting of physiological and psychological response to a noxious stimulus. This is related to the physiological aspect of pain. Despite the subjective nature of pain, it is mostly associated with tissue damage and comes from a physical source. On the other hand, the psychological perception of pain is a result from the brain's sensory processing of new infants, with existing memories and emotions in the same way that other perceptions are produced. Childhood experiences, cultural attitudes, heredity, and gender are factors that contribute to the development of pain in each individual's perception and response to different types of pain. Among the many different definitions of pain, there are also different types of pain, such as acute or chronic pain. Acute pain is defined as a physical distress that comes on quickly, which can be mild to severe, has a predictable end, and usually lasts less than 6 months. Chronic pain, on the other hand, is pain that continues for longer than expected, is constant or recurring, without an anticipated end, and usual duration is longer than 6 months. It may be caused from unrelieved acute pain and may persist even though the underlying injury has healed. These are the antecedents of pain. Pain is certainly a subjective experience that is related to a physiological process, but how individuals react to a new episode of pain is influenced and shaped by previous experiences. When someone has experience with pain and were undertreated for their pain, they will react differently than someone who was treated early and appropriately. Someone who has comorbidities, such as an underlying disease state that makes them have chronic pain, these people will also act differently when they have an acute pain experience. The event that led to a painful experience, such as a trauma involving a motor vehicle accident, which is a traumatic experience within itself, will allow for someone to have a different experience than someone who's experiencing pain from something small, such as a hangnail. The person's psychological state, such as if they have anxiety or stress, can also allow for them to experience pain differently than someone who does not. Along with this physiological state, the person's pain behavior is also influenced by social and cultural factors. Pain is usually a private experience, but social and cultural factors will influence whether pain that is private is translated into pain behavior. Each cultural and social group has its own way of expressing pain. There is usually a specific, standardized way of expressing pain, both verbally and non-verbally. Pain behavior is largely cultural determined, and so is its response to this behavior. This depends on if the culture values or disvalues the display of emotions, mobile responses, or verbal expressions in response to pain. There are some cultural groups who expect extravagant displays of emotion in response to pain, but there are also other cultural groups or social classes that value stoicism, restraint, and playing down pain. There are several defining characteristics of pain. First, it is an unpleasant and stressful experience that originates from a physical sensation. Second, it is an individual experience. No human experience is the same. Third, pain is a feeling of both sensation and emotion with behavioral components. Fourth, there is a physical and psychological response to the stimulus. Fifth, pain is a learned response and has a function. It is both protective and is a warning sign for other problems. Finally, pain is a learned response that is influenced by the environment, emotions, personality, and social and cultural values of an individual. The consequences of pain are related to the individual's interpretation of pain and the precipitating event that led to the painful experience. The reaction of pain has more of a physical and biological focus and is considered a pain behavior. There are two types of pain behaviors: voluntary or involuntary responses. A voluntary response requires conscious thought and conscious activity. Involuntary responses, on the other hand, are not under direct conscious control of the individual. These responses focus on involuntary, nonverbal, evoked responses, usually in the autonomic nervous system, such as reflex reactions and heart rate. An involuntary response may include an elevated heart rate or increased blood pressure. These responses usually also contain verbal behaviors. A person may use verbal cues such as crying or moaning. Verbal pain expression includes three levels of symbolization: an interpersonal communication, such as recognizing something is wrong; interpersonal communication, crying for help; and a more complex symbolic communication to others, which can depend on a person's social or cultural values. These people may also use nonverbal cues, such as rubbing at the pain site or changing positions to ease the pain. Pain can also cause other consequences for individuals, such as decreased mobility, decreased quality of life, depression, stress, and cause an increase in healthcare costs. Pain can cause a person to have a decrease in mobility, especially if the pain is severe enough. If a person has impaired mobility, this can cause a decrease in quality of life. If pain goes from acute to chronic, it may last for long periods of time and will affect every aspect of an individual's life, and can lead to depression or cause other stressors. As it has been said before, pain costs the United States billions of dollars each year and drives up healthcare costs for everyone. After much research, my resulting theoretical definition of pain: it is an individualized experience of discomfort caused by an internal or external source that causes physical and/or psychological involuntary and voluntary reactions throughout the body. My model case study for pain: Mr. T is a 54-year-old single Caucasian male who was diagnosed with lung cancer 2 months ago. Last week, his tumor was found to be enlarged, and his provider advised him that he would need surgery. When he was hospitalized after the surgery, Jane was the nurse assigned to take care of him. When Jane went to check on him, she found Mr. T to be lying on his back, with his knees bent. His face was scrunched up, and he looked to be tired. His bedside monitor showed a respiratory rate of 28, heart rate of 120, and blood pressure 152/86. When Jane began to talk to Mr. T, he closed his eyes, but was very cooperative. Mr. T told Jane that he was in pain, as he pointed to his incisional site. Jane then gave Mr. T pain medication and reassessed his pain level 30 minutes later. During this reassessment, Mr. T said, "My pain is much better. I hope I can sleep now." Jane then asked Mr. T, "Is there anything else I can do for you?" He replied, "I really don't know what I'm going to do now. My side feels better, but I'm not sure I can sleep. Do you think you could sit and talk with me for a little bit?" Jane and Mr. T then began to talk. Mr. T expressed not only physical pain, but emotional pain because of his cancer diagnosis and subsequent surgery. There are several measurement tools to assess pain found throughout the literature. One measurement tool that is commonly used is the Wong-Baker Faces Pain Scale, which is used as a self-report of pain to assess a patient's experience of pain. It can be used in children ages between 3 and 18, depending upon their cognitive ability. Face 0 is very happy because he doesn't hurt at all. There's no pain. Face 2 hurts just a little bit more. Face 4 hurts a little more, and face 6 hurts even more. Face 8 hurts a whole lot, and face 10 hurts as much as you can imagine, although you don't have to be crying to feel this bad. You then ask the person to choose the face that best describes how he is feeling. Another commonly used pain scale, specifically used for young children or cognitively impaired adults, is the FLAC scale, or Face Legs Activity Cry Consolability Scale. With this scale, each category is scored from 0 to 2, which results in a total pain score between 0 and 10. According to my definition of pain, the measurement scale that will most closely measure this concept is also one of the most commonly used pain assessment tools. This pain scale is used for adult patients and is called the numeric pain scale. The numeric pain scale measures pain from 0 to 10, with 0 being no pain and 10 being the worst pain. The numeric pain scale is used to self-report pain and to assess a patient's experience of pain. Since my definition of pain focuses on a subjective experience, the only way to accurately measure pain is the self-report of pain, and to look for involuntary cues that signal a pain experience. Pain is something that I measure every day as a nurse. Pain is now measured every time vital signs are taken and is known as the 6th vital sign. In my experience, I have always been taught that pain is what the patient says it is, and I have applied that to my own definition of pain. I will continue to measure pain throughout my career as a nurse, and will expand upon this when I become a nurse practitioner. I will one day be prescribing medications and therapies, and pain is going to be an important concept in my own practice.